I've got a couple questions just to warm up the audience, but we have 2 microphones that'll run around here to get questions from you for the presenters. So I'll get started while you think of questions you'd like to ask. Actually, let me start with Tom Rasmussen, who was up here last. And one thing, my observation of looking at that, what the program is doing is that it looks like it's highly effective, certainly by the visuals in the last family with the pile of food on their table versus the empty table. The question is, how do you scale this program given the people-intensive nature of having to train or nutritionists and analyze the needs and do all that very customized work to figure out what is right for a given location, maybe even a location in a given city or a given rural area? What is the right crop rotation to plant? So how do you scale this is my question.
Well, now you're asking for my 45-minute presentation. But briefly, I'm leaving for Kenya tomorrow. And we're working with Pwani University. I'll sign an MOU there with their agricultural department and the president of the university to partner with us. So we'll be using their graduate students who are doing theses in nutrition, agronomy, animal science, and so forth. We'll build a demonstration farm on their campus that their students will use as they develop this program. Ultimately, we hope that these universities, and I've met with them in several countries in Africa, as well as Central America, will incorporate a self-reliant agriculture as well as an agribusiness in their curriculum.
Great. So go local is basically the answer. Let me come back to the beginning then, to World Bicycle Relief. FK had a interesting and great point around the importance of quality in the bikes that are there, because if they fall apart, then what's the point of putting them there in the first place? And actually, I use SRAM equipment on one of my bikes that I've ridden through rural India, which has held together very nicely. I've been very happy with that. But you also pointed out about local sourcing, and I'm just curious as to how do you strike the balance between what you are doing actually locally, either building frames or other things that can be done locally, versus what do you have to import and bring in? Because obviously, the more you can do locally, the better, I'm sure. So how do you strike that balance?
Well, at the moment, we bring in parts from Taiwan, China, India, and sometimes parts in Europe to do the full assembly in Africa. We don't manufacture anything in Africa yet. That requires some scale, just some economic scale. But there are a number of things on a bike that you could manufacture there. You could probably start with the rear carrier, then the frame and the fork, and then you could slowly get into other components. But components on a bike are rotational parts under heavy loads, and those are tough to start manufacturing at small scale. But there's no reason that manufacturing can't take place based on demand from the field.
Good. Okay, any audience questions now that I've got the pump primed, I hope? Bill?
I'd just like to know a little bit more about the economic model of the bicycle business.
Okay, FK, don't run away.
Yeah. The economic model, if I understand the question correctly, in Africa is the basic productivity increase that occurs when you take someone that spends their life walking and puts them on the bicycle, and it multiplies their range, decreases their time spent commuting, and increases their carrying capacity. So it's our belief, and this is what we're measuring very carefully, is that simple value proposition can sustain itself alone economically. Does that answer your question? Or are you looking for Tour de France type stuff?
No, I just, do you give the bikes away? Do you sell them? What's the manufacturing cost? You know, some of that. Please.
Got it, thank you. In all of the not-for-profit programs we run, generally the bikes are on a work-to-own or study-to-own program. In the healthcare initiative, we did a 23,000 bike program where volunteer caregivers could own the bike after they've committed to 2 years' worth of care in the field. That resulted in a huge increase of retention in some of these volunteer care programs, which have a very poor track record of losing all the training you've put into a volunteer, and then they simply quit because they can't take care of their families and do the work. For the students programs, it's on a 2-year study to own your bike. And if you stay in school, then the bike becomes yours. If you leave school, the bike returns to the school to be reallocated. For the for-profit side, and that is we do sell bikes, because if we had to fundraise for all of our bikes, we wouldn't be able to get very many bikes out. But there are many organizations that come to us looking for a quality bike, and we've made it available to them to purchase from us. And they know that they're purchasing from a reliable source who's accountable. We guarantee our parts, our bikes, and we take responsibility for them when they get into the field.
Great. Okay, audience question. Here we go. And could we get the lights up in the room at all? That would make it easier to spot audience questions? If anybody knows how to do that, that's great. And then that way the video could go over there if they want to. All right.
This is a question based on one of Tom's slides, and maybe Tom or even Beth could answer it. It's the picture that showed the 3 different families, one with an empty table, one with just some corn, and one with a bountiful table. And I'm just struck by, in that instance and in the whole realm of microfinance and microcredit, that there's got to be a luck factor. Like, how did that one particular woman or family just happen upon someone who told them about this program versus the other woman who just lives in the forest and never heard about that program? So it's not a question, it's just a comment about the luck of it all, that some people around the world get benefit.
Good, thank you. Okay, another audience, here we go. Back middle, left side.
I just had a question for the woman from Heal Africa. I really understood the complexities of the problems in getting women to go to a health center, and I was wondering if you could talk a little bit more about what you found is the most effective way to address those complex issues, and how, if you've had success or what's been done.
Yes, part of it was bringing in the traditional midwives into the healthcare system, training them, equipping them. So then they become a part of the team. They refer women in. If they refer a woman into a maternity clinic because she's had prenatal care, so the TBA learns to know what are health danger signs and when she should refer them to the nearby maternity clinic. But otherwise, she follows the woman until the time when the woman is going to deliver. And if she delivers safely in a clinic, the TBA gets the traditional birth attendant, the midwife, the local midwife, who is a village woman, very little formal education, but often wise, and with extra training and equipment, she can do a good job. And she wants to do a good job. So then she gets $1, and the nurse in the clinic gets $4 for a $5 delivery. What we found is that really helps everybody. Is that it? And where these programs have worked, there's 99%. There's only 1% who die of the women in childbirth. Normally, the regular statistics are 1 in 13 in Congo dies in childbirth. And where the Safe Motherhood program has been incorporated and adopted in communities, the rates of safe deliveries and healthy babies and healthy mothers is just amazing. So we have so much demand from communities to come and bring the program there. It also includes family planning and spacing. And so, you know, then there's also access to PMTCT. If there's a place where testing isn't available everywhere, but, you know, it depends on drugs. And
Judy, I had another question for you. I spent a little time on your website this morning and saw in your FAQ you pointed out that so many people offer to give you donations and things that you can't practically take because there's just not a cost-effective way to ship them or to use
stuff.
them.
Yeah.
And so what you and what you said is, look, please, we need cash,
Yeah.
which is perfectly
I mean, people want to
reasonable.
help. You know,
Right.
and you know, we've had people say, look, my kids have outgrown their toys or their clothes, you know, can I ship them? And Congo has no postal service.
Right. So,
No.
but my question to you is, what else could the people in this room do to help you do more of the great work you're doing?
Well, I think I really am interested in other kinds of partnerships, but cash is the best in Congo because it's so far away, and we will source things locally. We buy medicine, we buy equipment. We have agriculturalists who come and teach the women in the safe houses how to grow more effective, and they're all Congolese. Everybody is Congolese. They don't have to fly in. They don't have to. All they need is transportation money to get out to where they're going to teach. So,
Okay. Thank you.
Thank you.
I had a question I want to add to for the Committee for Children for Paige McLeod. I'm curious how much you've dealt with the cyberbullying problem, which is a growing major issue in schools in the United States and anywhere that internet access is readily available. And have you tried to tackle that yet? And how's it gone?
Yes, that's a great question, and it's a question that's top of mind for so many people right now. We actually do look at cyberbullying, and we have somebody on staff who is recognized locally and nationally as a bullying expert, Mia Doses. And so one of our programs called Steps to Respect actually looks at bullying in general and how to go about preventing bullying on a school-wide level. And that program is currently being updated. It does include a small component on cyberbullying, but not very much. The new updated version will more directly address that.
Good. Okay, back to the audience. Other questions? Here's one up front here. Oh, one in the back. That's closer to the mic.
Hi, good afternoon. I think it's afternoon. I'm not sure. My name is Vanessa Siliesar, and I'm from Honduras. This is not a question, it's just a comment. I have been experiencing a lot of emotions since yesterday, and I want to share it with you because we are talking about development aid, and you know, we are really close to you, because I come from Central America, and I have 8 weeks in Seattle. This is a gorgeous city. There's a lot of people who understand what real aid means. But what concerns me is that I don't hear the voices of the people that you work in that images, or maybe in your work. And you know why? I used to work in Kenya as a volunteer in gender programs. My boss was really proud because we built a will for women in the community, and they start to cry all over. And I said, why? And I went to the group of women, and with my bad English, I asked them, what happened? Why are you crying? You have a will. Now you have water in your community. And she said, this is the worst thing that could ever happen to me. Because 2 miles is the time that I have to share with my sisters. And these people put this will here to help me, but they condemn me to do not have free time. She has the time to share with her sister. All the women who have been working the whole day at home, seeing their males sitting and smoking. So I'm wondering, are you listening us? I'm sorry. It's just that I just remember what Reagan says. We are the backyard. Yes, my country is surrounded by drugs now. The drugs that this country consumes. And you're not doing anything. You're not helping us. The women that I work with are dying because they are the house. They are the wives of the drugs dealers. They are fighting in our territory. And I was living in a really pacific and tranquil city. Now it's surrounded by violence. And I can do anything. Yes, I can do a lot. I can train my students to let them understand that it's just us. Because sometimes I feel in places like this, that this is about business. And I'm really concerned. I'm sorry. I feel privileged to be here with you. Thank you for bringing me here.
Thank you.
But really, listen us. We need you there. We don't need your money. We need your experience. We need your advices. But we need that you work here. I work with women and said, you don't have CEDAW, for Christ's sake. It's incredible. And there's just the 6% of the women in the Congress in this country. Think about you, too.
Thank you. Thank you. Okay, we have time for one last audience question before lunch. Anybody want to have the last word here? Yep, right in the middle. Get a mic there.
Question about the Woodland Park Zoo.
Oh, okay. Sorry. Here, sorry. We got
it's a much
first mic. We'll take 2 questions. Go quick.
Yeah, I'm going to kangaroos. I wanted to know, I love what you do. I've worked with wilderness organizations for a long time, and I love your holistic approach, including the human element and providing health care for humans and so forth. Very basically, what's the cost of a program like that, and what's your success rate? How many more kangaroos do you have, and how do you plan to expand that, and how many animals within the zoo are you doing this with?
So in terms of our tree kangaroo program, what I didn't even get to mention is what the landowners in Papua New Guinea have done is created the first conservation area in Papua New Guinea of over 150,000 acres of rainforests, home to the tree kangaroos. So that's a place where it's safe and the animals are doing very well. And it's also managing their resources because they're hunters. They hunt the tree kangaroos. But now it's become, this conservation area is like a wildlife bank where the animals can breed and then the young can disperse and then they can hunt them in the areas where they still hunt. So it actually has been very successful. Landowners have been setting aside land over the last 10 years, and they're already seeing a lot of wildlife back into their areas and closer to their villages, so it's easier to hunt and get protein sources. So that's going very well. We have about 10 programs at the zoo where we partner with community-based conservation programs. And we usually, when we're opening a new exhibit, we usually start a new program. So we're opening a new Asian tropical forest exhibit. We're working on a new tiger conservation program. Does that answer your question?
Thank you. Okay, very last question quickly in the center here.
This is a question directed to ClearPath International. Very interesting and exciting work that you do. This relates to advocacy, whether any part of your work involves pressuring the U.S. government to sign on to the international ban against cluster munitions, and also whether you partner with any organizations that work for the rights of the disabled.
Thank you. Obviously, working with the Department of State is, we take their money very happily. They're a very large participant in mine action community. And I'm aware that they haven't signed on. And we, by the way, have participated in the cluster munitions convention since the last 2 were held, as well as the landmine ban conventions. I don't think that we really do any advocacy directly with the Department of State. When we participate at the conference level, we do meet with people in the embassy, and we often do talk about it. But we're also well aware that the Department of State actually does quite a lot in the mine action field, despite the fact that they haven't signed on. And so we're supportive of at least that, and we'll hopefully wait until such time as they do sign. With respect to partnerships with other organizations, we do partner quite a bit. We actually have 11 implementing partners in Afghanistan. So we work with a lot of local NGOs, and primarily it's, to help a lot of disabled people. The focus for us happens to be on explosive remnants of war, but most of the programs like ramp building, you know, manufacturing wheelchairs. A lot of the programs that we do actually help all the disabled people in the country. So it just happens we have a slightly different beneficiary focus.
Great. Thank you all very much for your good questions. Thank you, presenters. Let's give you all a great round of applause. Excellent presentations from great organizations. Thank you.